teenagers maybe in their 19s, 20s, and then ultimately those females especially who are in the third or fourth decades of life, they have to be treated differently.
I totally agree with you, and that is why I was not touching all the other scarring things, but mainly when it comes to the hair loss, you see the three basic principles, and that is why you said you have to be aggressive in the beginning. It's the telogen effluvium, which is acute, and usually it starts with some sort of stress or something like that that is happening, you see. So you want to address that thing. You don't want it to go into the chronic telogen effluvium, because that's very difficult, and you will have bitemporal sort of loss of the hair. But you have to, and that is why I went through all those things, that you want to actually exclude the causes and come to the main diagnosis. If it is androgenic alopecia, the treatment is altogether different. If it is not androgenic, it is only like telogen effluvium or chronic telogen, then you want to use different models. And yes, all these things in the scalp, I personally, I don't think that finasteride is a bad medicine, and it has got those major side effects, except for she getting pregnant. It's okay. Otherwise, all the side effects are very minor side effects, right? It's the lack of understanding of how the finasteride works and how good is the finasteride. Even in men, the fewest of complications, which is, sexual, there is a problem with erectile dysfunction or finasteride syndrome, right, where people can get suicidal. That is more often supratentorial. That means it's a psychological associated. The actual studies which are coming up now, there are 2 or 3 major studies of 10 years. The rate is less than 1%. And even that is, if you address it properly, is really not there, right? Because we haven't seen. So all these medicine as a combination is a wonderful medicine. When it comes to spironolactone and all others, you have to be a little bit careful. But spironolactone, instead of using at 100 milligrams, you can bring it to 25 milligrams if you add 0.25 milligrams of oral minoxidil, right? Then you can actually reduce the dose, and it is quite good. So that is how you can reduce the complication of each medicine. Normal minoxidil is 5 milligrams oral, so if you bring it to 0.25, which is really nothing, so you can really have some wonderful results. And the combination therapy is always good, because it's not one factor which is affecting. There are multiple factors. It could be some sort of chronic inflammations going on. So that is why you can inject the ozone. That is why you can have low dose laser therapy, because it's going to help you to increase the blood flow. Minoxidil increase the blood flow. So I think if you can try different cocktails, one of them will work for you. And if it works for you, wonderful. Share with us. You don't want to share, good luck.
The moral of this presentation is that, first of all, identify the cause.
Exactly.
Very important. After identification of the cause, the age of the patient, and then you treat the patient, because this is how you go about treating telogen effluvium, diffuse hair loss. Regarding what you said about chronic disorders causing hair loss, so you have to identify if it is a collagen disorder, if it is lichen planopilaris, if it is DLE, if it is systemic sclerosis, or any problem causing scarring alopecia, then you have to address the underlying cause.
Exactly.
Because if you are not addressing the underlying cause, like the autoimmune diseases that we have, so then there is no use of only giving topical therapy or PRP, because the collagen disorder is still there. So I personally feel, what I have seen in my practice over the years is that you must identify the cause, treat that underlying cause, and then go about the treatment topically or cocktails or whatever we are giving.
Sure. For this lectures, all the pathological causes were not included. It was only 3 ones: androgenic, telogen effluvium, chronic telogen. Rest of them I did not touch, because you people know much more than I know about them.
Excuse me, sir, in response to your suggestion, Professor Atif Kazmi,
Sorry, I did
is the main focus is on the telogen effluvium and androgenetic alopecia, you were suggesting DNCB and this capsicum and short course of steroid, which is the treatment of choice in case of alopecia areata, as the main focus over here is the androgenetic alopecia. Still you think that your treatment is effective in androgenetic alopecia?
Yeah, I think so, that what I have tried is alopecia areata is a very common problem.
The
and
main
I
focus
write-
is not alopecia
No,
areata.
I know.
I think
But
we need
then,
to wind up the session
then
because
the same treatment can be given to patients of telogen effluvium. And this is my experience.
it's a very
And
lengthy,
I
it's
have,
a lengthy
I have
topic.
had good results, but then ultimately giving short course of steroids, it's not necessary to give them only in alopecias. We can give that in diffuse hair loss as well. And the results are there.
Okay, one quick thing I really want to tell everyone is that the topical minoxidil, which gives hypertrichosis on the temples, so I usually tell my patients that instead of spraying, because the spray comes on the face, put it in a dropper bottle and make partings, and then you apply, so that really helps in prevention of hypertrichosis. And I've seen that my patients rarely ever come back with hypertrichosis after minoxidil. So I know a lot of people are using minoxidil. So if this tip can help your patients from, getting hypertrichosis, so that's what I wanted to tell you.
Thank you very much, Dr. Humayun, for the lovely talk.